Hello everyone, my name is Jamie. I live in Minneapolis, Minnesota. I have a 7-year-old and a 2-year-old, and I work as a staff birth assistant at a high volume birth center. I used to work at another birth center that was fairly busy, but not quite as busy. They did 15 or so births a month. The birth center I'm at now, we do about 30 a month. And then I've also worked in a couple of home birth practices. I feel pretty comfortable with auscultating fetal heart tones, both in prenatal visits and during labor. I personally have used a Pinard horn, a fetoscope, a Leth stethoscope, and a Doppler. The birth center where I work now, we do NSTs when clients when they go to 41 and beyond. So in the 40th week, we do 1 NST, and then after 41, we do 2 that following week. The birth center I work at now has both CNMs and CPMs on staff, so that's why we do the NSTs, or have the capability to do that. So I have hooked clients up to the NST, but I don't think CPMs can actually technically declare whether NST strip is reactive or not. I think that has to be a CNM. So I know what to look for, but we always have to have a CNM sign off on it. So that's sort of my experience. The first midwife I ever worked with only used a fetoscope, both in prenatals and during labor. And then my second preceptor primarily used fetoscopes during prenatal care, but preferred the use of a Doppler during labor. And I have to say that's my personal preference too. I think fetoscopes really help you get a sense of the baby's position, which is why I like them during prenatal visits. And every once in a while certainly will use one at a labor when we're a little perplexed about baby's position. It can certainly help illuminate some things. Yeah, so that's my experience. And then I've used a Leth during labor one time for a client who was really uninterested in having any Doppler technology used during her pregnancy or her labor. And we were able to use it even in the water. It was pretty cool. But I don't think that it would be my preference just because it's a little bulky. So yeah, that's my experience. One of the CNMs at the practice I work in now is also a sonographer, so she can do ultrasounds and things like that, but I have no experience. We have a bedside ultrasound that we use. It's like on an iPad. And sometimes we'll use it to confirm baby's position, but it's not something that I have. It's usually I get it set up for the midwife and they do it, so it's not something I have direct experience doing. And I know technically I don't think that's within our scope, though I know many CPMs will use an ultrasound just to make sure they're ahead if they're not sure. So yeah, that's my experience. I'm excited to get to hear what other people see in their communities. I know everything's a little different everywhere else, so it's always fun learning what the community standard is in other places.